So welcome everybody to this, our first panel with some of our, some more incredible innovators, social innovators. Today, the first panel's theme is investing in public goods for social innovation. And we often think of public goods as, they're often invisible. We think of them as, the backbone infrastructure that is provided to us by governments. But increasingly, we're having social innovators and even companies like Bayer investing and building these public goods to serve both the innovators and their markets, their clients, some of the most vulnerable people in the world. And so today we have four amazing guests. We have Emily Michaels from Medic, yes, Philippe from Path, Sieka from Agrifin, and Sky from Digital Square. And so I'll just kick things off with Emily, and I'll ask her, I'd like to ask, just to make it clearer for the audience, what kind of public goods are social innovators and companies investing in, and why is it so important? And perhaps, Emily, you could tell us a little bit about what Medic does and your community health worker digital platform.
My name's Emily Michael. I'm with Medic, formerly Medic Mobile. We are the steward of the digital public good called the Community Health Toolkit. And we see a really unique opportunity to fill a gap in health systems where digital health has sort of stopped. So you have digital health at the facility level, at the regional level, at the national level. But where we weren't seeing digital health reach is the communities that the last mile. So these are communities that are often offline. They are served by health workers that are majority women, many unpaid, many not trained after a first couple days of in-service training, and then let loose to say, now take care of 500 people in your village. And you go into some of their offices and you see just stacks and stacks of paper, and where is this information going? And there was a market failure for connecting the last mile of health with the digital infrastructure that was being built at every other phase of the health infrastructure. So we see a really unique opportunity to say, well, here's a digital public good, or here's a need for a public good, because there aren't for-profit companies coming in. The governments at the moment don't have the capacity to serve this disparate group of communities. And because of the digital transformation that we've been able to see through the Community Health Toolkit, unfortunately for all of you, you'll hear me talk again tomorrow more about the CHT, but we're seeing the opportunity now to prove the outputs of last mile health workers that provides a way to incentivize governments, incentivize aid, incentivize donors overall to say, this is the care being provided, this is how we can show it through data, and here's a public good that can be built on in a sustainable way that governments can own eventually. So the CHT is a platform that other people can adopt, but it is really filling a need that is now being proven and is able to be scaled and undertaken by governments.
And you mentioned that a lot of this care, 70% of this care, is provided by women, and often their care work is invisible, goes unpaid, is unrecognized. And so one of the themes of the Social Innovation Day is women empowerment. And so perhaps you could tell us a little bit more about why it's so important to empower these women in this way, and what your public good is doing to...
Absolutely. So we know that I think 50% of all care that happens in the home. And that might be families caring for one another, but it's also care workers providing for one another. If you look at so many communities around the world, there is a woman taking care of that neighborhood, taking care of that village, taking care of that community, but without recognition for the amount of care that they are providing, without saying, it's hundreds of thousands of children being screened for malnutrition, it's a 98% facility-based birth rate if you've got a fourth antenatal care visit logged. You aren't seeing the importance of care workers. With the ability to provide digital health, you can then layer on supportive supervision models. You can then layer on data quality and data integrity. You can layer on workflows for universal health coverage that make the case for a professionalized community health workforce, that make the case for remuneration, that make the case for these women shouldn't just be doing this in return for having access to care. this is a professionalized group of care workers. Here's the care they're providing. Let's make sure that we're advocating for the people providing that care.
Excellent. Thank you for the important work that MEDIC does. Yes. So moving to you, Sieka. You work at AgriFin, and you have a platform called Sprout that is kind of providing some of the digital backbone for many of the organizations that we've heard from already, including Pula and DigiFarm that presented this morning. Maybe you could tell us a little bit about how Sprout helps their work and contributes to building a public good.
Thanks, Anjan. And maybe I think just for the audience's purposes, just to explain what Mercyco AgriFin does, we work with tech innovators to really design, test, and scale their solutions to provide digital services to smallholder farmers across multiple geographies. And so typically, when we are working with these innovators, what we found over the last 7 years is that an important part of the bundle was good agricultural practices and agronomic information. And we saw that a lot of the organizations that tried to make a business case of this, really delivering these services, were unable to do this satisfactorily. Yet the demand for this information as part of a bundle, be it a bundle with a financial services, so whether it's a bank that's trying to offer a digital solution to farmers, bundled with information, or a telco, et cetera, they were having challenges getting the right kind of content, customized and curated for the different channels that we're using to serve farmers. So at AgriFin, what we did was which is not typical of our work, is that we became a social enterprise that is actually connecting content developers, so organizations that develop content of various forms, whether it's pest-based content, whether it's agricultural practices, et cetera, and put them on a platform where we connect them with farmer-facing organizations like MyAgro, DigiFarm, et cetera. To date, we have about 20 different organizations accessing this content. And the beauty of putting them in such a platform is that you then have a naturally occurring development of the content so that it's suitable for various segments in the agricultural sector. So we have the farmer-facing organizations that once they deliver this content, they get feedback from the farmers, they give this feedback back onto the platform, the content is curated further so that then the delivery and the education and the learning can happen seamlessly across to the various populations that we serve. So content is probably one of the biggest public goods that's required for agriculture to really move forward for smallholder farmers. We all know that similar to what my colleague Emily said, the extension services network is not working in most countries. And even though private sector organizations are trying to build their own extension services, it's not going to be enough to cover the 60% of farmers that are smallholder farmers feeding the African populations and a lot of other countries in the global south. So something has to be done to truly get their capabilities, their capacities uplifted so that they can be able to be resilient, especially in light of the climate crisis.
Yes, thank you. Yeah. You touched on an important point there, Sieka. Like, a lot of the social innovators' work begins with support from grants and donations, and there's a need to transition to make them financially sustainable, and content and technology is an important part of that transition. So could you tell us a little bit about how your work is helping some of the innovators become, self-sufficient in their own right? And
yeah, great question. A bit off, but great question. So at AgriFin, we have this true belief that one of the important drivers of economic development in the global south will be technology. We see that as a huge opportunity and a big challenge, because if the global south, disadvantaged communities are not part of the digital world, then they're going to lose out on a lot more other opportunities. For example, we're all talking about women empowerment right now. Some of the things that can really reduce the barriers to engaging women is technology. I'll give a very typical example, digital financial services. Currently, women have a challenge getting access to finance because they don't have collateral, either they don't have land title or various other things. And digital allows women to actually get access to these services. Rose from Pula mentioned that they're able to now provide insurance services across to various farmers, and just using data, uncollateralized insurance based on data, and uncollateralized loans based on data. So digital services actually help to remove some of the barriers that women are facing in terms of getting access to various resources like financing, et cetera, et cetera. So to your question, more directly to your question, when we work with organizations, especially social innovators, we help them identify what are their pathways to digitizing their solutions so that they can get to scale. What are some of the barriers? And we recognize that many social innovators, as much as their ideas are great, sometimes they're not founded on, I think Dr. Obi mentioned, the science behind it, or in technology terms, the computer technology behind it. Building out digital infrastructure that is scalable, that will work for the multiple use cases and purposes you need is a costly enterprise. So what we do is we direct a lot of technical assistance to these organizations to help them design the right kind of solutions, to help them test those solutions, oftentimes deploying services like human-centered design, which many of these organizations would not afford. Getting human-centered design so they can identify the right archetypes, the right minimum viable products that will truly help their solution scale. We test this, and we look at the impact, and then we share this with the broader community so that the ecosystem can benefit from those lessons.
Excellent. Very valuable work. Yeah. So before I come to Philippe and Sky, I just want to remind everyone that in about 10 minutes, I'm going to open to questions from the audience. So please do interact. Please, if you have any thoughts, any questions, anything you'd like to hear from them on. And if you're an entrepreneur yourself, if you're supporting entrepreneurs and you hear about work that's happening up on the panel, don't feel shy. Please, suggest how you might collaborate. That's also valuable to hear. And so, Philippe, perhaps you could tell us about the development of the COVID vaccine that was also sponsored by Bayer and that Path developed. And
Absolutely.
Yeah.
Maybe I'll just do a brief introduction of what PATH is, because we are often not that well known. So we are an NGO, bunch of entrepreneurs, about 1,600 people around the world, working across 70 countries, and we work across 5 platforms. We work around vaccine development, and I'll talk about that in a minute. We work on diagnostics development, point-of-care diagnostics, because failing to make the right diagnosis leads to the wrong treatment and poor health outcome. We work on developing medical devices, and most importantly, we work on public health intervention side by side with governments and communities to support improvement of health outcome, primarily around primary health care. So when it comes to vaccines specifically, we've been working on vaccine development for years. And one of the vaccines that we are extremely proud of is a vaccine called Menafrivac. This is a vaccine that was developed about 20 years ago to address meningitis. As most of you know, we've got a meningitis belt that goes from Senegal to Ethiopia, and meningitis outbreaks have been plaguing that region for years. Meningitis vaccines were utterly unaffordable for this region, and together with WHO and Serum Institute, we went on and developed that vaccine with a target price of 50 cents per dose. And everyone thought we were absolutely mad launching in that adventure. We now have a vaccine that has benefited about 400 million kids in that region for about 50 cents a dose. The good news is that we haven't had any meningitis A outbreak in that region for years now. Yet, what we are seeing is that we have other strains of meningitis that are resurgent, and we are in the process, still with WHO and Serum Institute, to develop a polyvalent vaccine that will address the various strains, and that is currently under review. We hope to launch it next year, and that will align with WHO objectives of eradicating meningitis at the horizon 2030. So that was a bit of a circumvented introduction. I'll talk now about the COVID vaccine. This is a critical global good. We've all heard the rush for COVID vaccine in the early stage of vaccine availability, and too often countries, low and medium income countries, being shortchanged. We had a phase where there was no vaccine available, and then we had a phase where some vaccine was available, preferably the one that Europe didn't want to use. We had cases of a vaccine sent with a very short expiry date to countries that didn't know how to manage that. And rightly so, and there was lots of outcry when DRC decided to actually send those vaccines back, saying, you're sending me millions of doses of vaccine that expire in 3 weeks' time. I cannot do anything with that. And they were right. I think we should be, when we are aiming for equity, we should be truly equitable. And by doing that, we are not. There is now a significant push for countries to develop their own vaccine capacity. And this is in that respect that we've been working, and we continue working with Bayer in developing an egg-based vaccine similarly to what we are using for developing flu vaccine. Why do we do that rather than the mRNA approach? We are doing that because most countries already have the capacity to produce. If you want to set up a plant from scratch, with technology such as mRNA, it's going to be 10 years before those plants start producing, and we cannot afford to wait 10 years. So using a proven technology that's already available in country really can help change that. And we are working with Bayer on that candidate in Vietnam, but we also are using the same approach in Thailand and in Brazil. And once those 3 countries have vaccine registered, that will enable to unleash hundreds of millions of doses per year that will be available, produced close to the people that are needing those vaccines. And this is what we call equitable access to vaccine.
Very important. Thanks. Yeah. What do you see as some of the major obstacles to achieving that kind of equity that you've highlighted? Is it political will? Is it technological?
I think there are various elements. I think the political will, particularly in a low and medium income country, is absolutely there. But I think there is also a bit of ego at play, where everyone now wants to have a manufacturing plant, whatever it costs. And I think it is important that as an international community, we look at it in a rational way. And we look at it in a way that those plants will serve the needs to which they are intended to, and this is access to vaccine for the population. We no longer have huge shortage issues of vaccine. One of the issues we are facing, and you'll hear me talk a bit more about that tomorrow, is actually the desire from populations to be vaccinated. And there we are guilty of the current situation. Again, we provided them with vaccines that we said, nah, we don't want them in Europe, thank you very much, you guys can have it. And that's not a really appealing approach. And now we are battling back with people saying, well, why do I need vaccine? Why do I need to be vaccinated at that stage? So there is lots of awareness, lots of working with communities to make sure we understand the barriers toward vaccination, and I think this has a triggering effect way beyond COVID. We have managed to achieve about 90% coverage in the routine immunization, so for infant vaccination. And this is a great achievement. Yet we are still missing 10% of children that get zero vaccine. And this is what we need to focus on when it comes to equity of immunization in general. The COVID situation is really bringing us backward because we've somehow defocused our targeting of those missing children, and we really need to put that back at the center of our priorities, because vaccines is saving millions of lives. Many of us would not be here in this room today if it was not for vaccination when we were children. And there's a huge discussions about the return on investment on cryptocurrency. You guys should be investing on vaccines instead. We do estimate that for every dollar that you invest on vaccine, you have a return for the society of $50. So even Bitcoin cannot beat that.
Coming to you, Sky, Digital Square is actually hosted at Path, and it addresses exactly the points that Philippe is making, some of them health equity. Could you tell us a little bit about how Digital Square does that, about your work, about the platform?
Yeah. So my name is Sky Yoden. I'm the executive director of Digital Square, hosted at Path. And Digital Square is about 6 years old. We actually came out of the 2014-15 Ebola crisis in West Africa. At that time, many different digital innovators were coming to Sierra Leone, Guinea, and really trying to use digital platforms to help manage the epidemic there. Unfortunately, the digital systems that went into place created a lot of confusion. They had conflicting and sometimes erroneous information. So decision makers had two different sets of information, didn't know where to allocate resources. There was a lot of challenges of people trying to deploy cloud-based solutions in areas with no internet connectivity. So really big challenges. And a community of 40 partners in the development community came together and said, we can't manage a pandemic like this again. We've got to get smarter about how we use digital tools. And out of that, Digital Square was born. We're a collaborative of many partners, including Medic. And our aim is really to support the scale of digital solutions for low-resource communities. And for us, public goods are an essential tool to do that because they often allow you to focus on requirements like offline functionality that may not be on the product roadmaps for for-profit companies. They also, I think, we support a lot of public goods. Basically, I think there's two things that are really important in our ethos. And when we support groups, like Medic and others, one is really trying to develop and support solutions that scale, but also promote inclusion. So really identifying what are the requirements that underserved communities need and that are currently neglected by solutions in the market, and supporting public goods to fill those gaps. And then the other thing, in honor of women's empowerment as a theme, that we're increasingly interested in is improving representation around people who are making decisions about digital. I had a donor say to me a couple years ago, in data there's a lot of bias, but for digital it doesn't matter. And no, it really does matter. And here's I have one great story, an example of this. We had a digital supply chain innovator, a friend, but also someone in our community who came to me and said, look, in my data set, I have a lot of cold chain managers, and what we're finding is that the female cold chain managers manage their stock better than the male cold chain managers. However, we're finding that the women stay stocked out for longer. And he's like, I can't reconcile this. And I said, well, who's managing these people? Who's sending them the supplies? Oh, that's a district level manager. Those are 97% male. I said, well, do you think that they might be treating the orders from females and males differently? He went, that's an interesting hypothesis. I'm going to test that. my lived experience allowed me to generate hypotheses that hadn't occurred to him. And this is why representation in digital matters. The hypotheses you generate and the questions you ask are different based on different lived experiences. And and we have a solvable problem, but a problem in a lot of our digital governing bodies, whether they're government governing bodies or the governing bodies within products making decisions, even my own board I'm working on. The more representation we have, the better we'll be able to serve communities around the world. And so Digital Square is both supporting tools that are serving populations that are generally not underserved populations, but also we really want to focus on how we're doing the work that we're doing, and through that, improving representation.
Excellent. I suppose it's somewhat fortuitous that you built your platform from the Ebola crisis, but then it became handy sort of in the last couple of years.
Yeah. So there are things that went a lot better in COVID, but it's still a pandemic, so we're not 100%. But I think that some of the things that were really gratifying for my team, and I think for the whole community, is that in this COVID pandemic compared to Ebola, we got data standards in place relatively quickly. And we had a number of tools, I think 13 within the community of 36 goods that we support, that all aligned to the standards and were very quickly able to adapt their platforms to support data management around COVID. And with that, the tools that we support have reached over 70 countries at this point with COVID data management solutions, whether it's supply chain, whether it's around tracking who's been immunized, who needs to be immunized, what communities have been reached. And I think that those are all really great gains and were made possible because the community actively worked on addressing the problems identified during the Ebola pandemic. There are still places where we haven't fully got it right. I think that one of the challenges that we're facing now is in a lot of countries, there's a massive data backlog. So you have a lot of the rollout, you still have folks that, their system was down or they weren't able to find a place to charge or for whatever reason ended up doing lots of paper entries that haven't gotten into electronic systems, which then makes it hard for national level decision makers to know where to allocate resources. So that's still a challenge. A lot of the digital registration, I had a colleague on my team, Kenyan, and she went to a health facility to get her vaccine, and she noticed long lines of people, and particularly in that community, folks over 50 who were unable to get a vaccine because in order to register on the digital electronic immunization record, they had to have an email address. Well, they didn't have an email address. So then my colleague was actually, God love Sophie, she started giving them email addresses. Here's where you go. She's like helping them get their email address so they can register and take the vaccine. So we still have a lot to learn about how to bring women and many people throughout the world into the digital community in a way that's seamless.
Absolutely, yes. And so here's an example of where investment in a public good sort of really helped, crisis. Yeah, go ahead.
No, and maybe to further illustrate what Sky was saying, we had a very interesting case in the early stage of the COVID crisis where suddenly, WHO said, if you've got fever, you don't go to health facility. Well, that applies very well to Berlin. Doesn't really apply very well to Africa, where there are many, many reasons for fever. And we are extremely worried, but thanks to digital in particular in Senegal, we were able to early on measure the drop in healthcare facility usage from the get-go, and we were able to correlate that with COVID incidents. And simply by having this data, we were able to work with Ministry of Health in ensuring that the messaging was changed. And while the under 5 healthcare usage had dropped by 80%, in April, we were back to normal in September, in time for the malaria season. And this is great credit to the digital effort that has been placed by the government.
Any questions? I'm curious from the audience? Great.
Hi everyone, my name is Curating. I'm part of Bayer Consumer Health, so the company side of things and the division focusing on self-care. I want to kind of brainstorm a little bit about the great title of this panel, which is about public good for innovation, right? Obviously, I will come from the perspective of health as the most fundamental public good and the foundation for really any life, and ag and everything going from there. And I really had a question for the whole panel, probably a little bit more to you, Seka, and also back to Rose from the earlier presentation as well. Because I'm really curious to hear your perspective on the value of health as being a collateral. And I piggyback here as well on the comments made about women, especially women, smallholder farmers who have zero assets. They don't have land rights, they don't have anything. The only thing they have is their health. That's it. So, brainstorm question, how might we measure, leverage, invest in health, especially women's health, or at large, smallholder farmers' health, right, as being also a measure of their own resilience for their own business model, for their access to finance, for their access to insurance. So, how might we turn that public good into innovation around that?
Seka, would you like to start?
Yeah, that's a great question. And although we don't work directly in health, we have come to find from a lot of the engagements and projects that we're doing, especially when it comes to financial services, we find that sometimes it's not the need for either insurance or a loan for inputs. But many times what the women and generally the farmers are asking for is, I need money to finance a health situation. Yeah, I need to pay for someone who's in hospital, or I need a health insurance, etc. So it is a critical component, even in agriculture, as you're looking at it, and you're looking at the bouquet of services that, from our perspective, would lead you to adopting and using a digital solution. If you can cater for some form of health in that package, then there's possibilities of actually including a lot more people. And it is vital, of course, to their resilience. We all talk about increasing productivity and yields. And we look directly at the quality inputs, we look at access to finance, access to markets. But if I'm sick and I can't work on my farm, then I am unable to increase my productivity. Yeah, so that's a critical element. We've not done a lot of work directly, but yeah, I think that's a theme that's coming up. That we should definitely be addressing a lot more. I don't know if Rose wanted to, is she still here? I know she had another engagement. Okay. Yeah, but thanks for noting that. Just a point from Felipe's presentation. I think one thing that we're seeing, and very important, you talked about vaccine hesitancy. Mm-hmm. I think from our perspective in agriculture, there's also digital hesitancy or adoption hesitancy, which is something that we need to tackle. And I think this theme of, we know that digital can resolve a lot of problems, yet not enough people are digitized or willing to get digitized. And I think working around solving for whether it's hesitancy to get the vaccine or hesitancy to use a digital solution, it needs the same behavioral approach and a lot more collaboration so that we can understand how to accelerate adoption of these solutions. And that's something that we probably have to work a lot more collaboratively on.
Yeah. Great. Yes, maybe I could take a couple of questions. Yes?
When you have a policy to support digitalization, if you have like one wish, what would it be? What would, from your perspective, have the most impact to really drive technology adoption?
You know, because he asked that question, now I must piggyback on his question, which is that as we increasingly think of the beauty of capitalism and yet the kind of inequalities that it has addressed, and we know that we have to, through public policy, figure a way to make capitalism work for more people. So it's in the realm of public policy, right? How do we design so that market-effective solutions gets to the bottom of the pyramid, and yet, is a kind of subsidization of public goods, right? But from an entrepreneurial perspective. And what are the ones that have worked at scale And how do we study this as a way of, really making a global action, fastening the speed.
Absolutely. Emily, would you like to?
Yeah, sure, I can start there. And I'll start kind of in the middle of some of these questions and hopefully touch on a number of the themes. I think that when we're talking about building tools for communities that have been left out of digitization and have been left out of entire movements, we can't sit in a room like this and say, well, what do we need as funders and innovators, and what do we need to get out of these communities in order to improve their health? We have to go to the health workers, and we have to go to the communities, and we have to say, what will help you provide health for your community? So it isn't us saying, well, if you do 4 antenatal care visits, then you're going to have increased facility-based deliveries. It is them telling us, we have to go talk to women about the value of giving birth and the likelihood of better health outcomes if they deliver in facility. So starting with that human-based design approach, because if we don't start with how do we make the lives easier of whatever products that we are developing, then they aren't going to be used. And if they aren't used, then the data is null and not helpful. But then there is the fact that in a recent survey, I think 80% of digital public good owners or stewards said that financing and sustainability were their greatest challenges. So we don't have an answer for the sustainability of digital public goods. And part of that is the policies around incentivizing the use of digital public goods, whether that is adoption of national governments or use by NGOs. They might opt for proprietary products that then can't be implemented or can't be integrated, can't be scaled. So how are we incentivizing the use of public goods for public infrastructure? How are we creating sustainable financing models for the implementers of public goods? And then how are we sharing the knowledge of, yes, this technology is free, but servicing it, adapting it, implementing it does have a cost. And not just a cost to say, we are now going to deploy this in Mali, Niger, Kenya, Uganda, but a cost to uphold the platform and the building blocks of what each public good is built upon. Because the CHT is able to create apps that are used in 15 countries, but we're also built on public goods. And we rely on foundational blocks that still require this investment. They're still looking for what is the sustainable model, which Path and Digital Square specifically is working on quite a bit. But until we're answering some of these puzzle pieces of how does it work for the end user, and the end user is not a Ministry of Health that's looking for health data. The end user is the actual care worker or the actual small farmer. And then coming back up to, all right, well, now what are the institutionalization of using public goods? We have to answer each question along the way, which is a great global challenge that we're all working on together.
Thank you. Sky, would you like to close out the panel? We have a couple of minutes. Yes.
Yeah, I think that you said that really eloquently. I did want to come back and talk a little bit about digital hesitancy specifically, because I know that was a big question. I think that whether it's vaccine hesitancy or digital hesitancy, it ultimately really ends up being a matter of trust. And so the question is, what fosters trust? And that might vary community by community. It's important to listen. It comes back to, I think this is another reason why representation matters. If you have representative decision makers, they can be creating collectively digital solutions and messages and content that do foster and engender trust across a wide range of communities. But I think that also we're at a real moment in time where in many countries, the United States is a really great example of this, trust is being eroded actively. And so I think this question of hesitancy is far bigger than digital or immunization, and really is how do we just collectively, in the work we do, work towards rebuilding trust within our communities and then across our communities.
Okay, last
literally 30 seconds, guys, because I think trust is absolutely essential. But trust or lack of trust doesn't come from nowhere. If you think about health facilities, and if you realize that there was a study published a few years ago, and we were discussing that just before this panel, showing that more people are dying from poor quality of care than dying from lack of access to care. We should pause and reflect. When you read that actually women in labor, 25% of them, it's a study from Senegal from a few years ago, are abused, yelled at, or beaten during labor because they don't deliver their baby fast enough. We should all pause and think again. People are no fool in community, and we really need to rebuild trust by constructing a health system, a digital system that meets their need. And for that, we need to be working with community, we need to be understanding community, and we have the community to drive our actions rather than the other way around. And only by doing that, we will rebuild trust, I do believe.
Thank you. And yeah, just to complete
quickly
it.
add on the policy question. I think policy is critical. Government involvement in supporting whether it's the digitization of their communities that have challenges accessing digital tools, like she was saying, just a simple email address. Just the same way that most communities are taught read, write on paper. I think we have come to a time where you need to be able to manipulate a digital instrument that is accessible to you. And policy needs to support this, and governments need to either subsidize or support efforts to ensure that those populations that are disadvantaged get access to these digital tools as a basic right. So to answer your question, yes, definitely policy plays a big role in making sure that digitization efforts work.
So thank you to all our panelists. Thank you for your questions. Yes. They've come from quite far, from Atlanta, Seattle, Geneva, and Kenya. So thank you to them for being here, and also to all of you for coming.